Our second topic are common back injuries that occur on a daily basis. Approximately 80% of back injuries that occur are due to flexion or bending forward injuries. This includes poor posture, poor lifting technique, as well as repetitive strain injuries over a period of time. Approximately 95% of back injuries occur to the basic structures within the back. These include the muscles, the joints, the discs, and the nervous tissue. Health professionals are able to differentiate which structures have been injured and therefore can give an appropriate plan to yourself to make sure that you get back to yourself as soon as possible. Approximately 3 to 5% of back pain are caused by what we call serious pathology. These are called red flag issues. These include fractures, dislocations, and nerve root compromises. Due to the serious nature of these injuries, I will not be talking about their management today, and they are something you should seek your healthcare professional about straight away. Lower back pain accounts for approximately 75% of all back pain patients I see on a daily basis. Most of these are caused by flexion-based injuries. This causes the muscles and joints to stiffen up, become tight, and therefore start to cause pain. Moving up the back to the thoracic spine. Most of the injuries to the thoracic spine are caused by rotational forces. As your ribs attach to your thoracic spine, there's an increased chance of injury due to the extra joints where the ribs attach to your spine.